Okay, in this video we're going to cover the side-lying hip abduction exercise and how we can execute it two different ways to direct loading into different tissues depending on the goal. We're also going to talk about this within the context of treating a lateral pelvic tilt, where we have one side of the pelvis that tends to sit a bit higher than the other side. And typically this can be due to limitations at the hip or in the trunk. Okay, first a bit of anatomy. Which muscles perform hip abduction? So the prime muscles are going to be the glute medius and minimus, which sit on the side of the hip here in this kind of indent in the glute. Then you'll have the TFL. The TFL is also a hip flexor. And then you'll have your sartorius, which the prime motion isn't hip abduction, but it's still lightly involved. Now let's talk about some of the lateral flexors of the trunk. You have your QL, your obliques, and then you even have your lats. If I want to get some length and loading at end range through the glute medius and minimus, we're going to want to have a hike in the pelvis. If I hike the pelvis on this right side, I'm getting a relative adduction of this right femur. Whereas if I drop the pelvis on this side, I'm getting a relative abduction on this left femur. So you can even try this. If you hike the right side, you should actually feel your lateral hip musculature kick on. Whereas we're bringing length into the lateral hip musculature on this side, especially if we keep the feet on the ground. So if I want to get length into the glute med and min, particularly the posterior fibers of the glute med and min, then I'm going to want to be in a little bit of hip flexion, and I'm going to want to emphasize this pelvic hike. Now, a useful assessment I like to perform on clients to see if they're limited in the ability to ab and adduct their hip through the closed kinetic chain with the feet on the ground is the pelvic shift test. So just standing here, I like to see, can we shift the pelvis to one side and then allow the trunk to laterally translate the other way, and then do that on the opposite side. And oftentimes we'll notice a restriction on one side. Now we can even do this in hip flexion as well. I'll show you on the table, where the knees are directly under the hips, and then we shift the pelvis to the side. Okay, something we want to note is rotation. So oftentimes people will shift to one side and the belly button will rotate the opposite way. We want to keep the belly button directly facing down and notice differences side to side. We can also test flexibility of the trunk musculature, like I mentioned, the QL, the obliques, and the lats, with a side bend, but keeping the pelvis fixed. So I can have my hands on the side, trace down the outside of the thigh, and we're looking to get the fingers past the middle part of the kneecap without any rotation. So oftentimes we'll side bend to one side, and then we'll want to rotate away to try to fake that lateral bend. Another compensation we'll see is we'll utilize the hip, and we'll try to translate that pelvis to the side as we laterally bend. And you can see I can get much further down because I'm allowing this lateral hip to lengthen. When it comes to the standing lateral shift test, I'm not necessarily looking for a particular normal degrees of adduction and abduction, but we're just simply looking for differences side to side or any pain. So oftentimes if we go out to the side, we might get a pinch in the medial side of the hip. This can indicate that the lateral hip tissues aren't lengthening properly. Okay, let's get into the nuances of the exercise. Now, a little bit of load can go a long way, especially with open kinetic chain exercises, when the weight of the limb alone doesn't provide enough leverage to get a strong stretch. Now, with this exercise, I care more about the lengthening portion, the deep stretch, and less about how high I can abduct the leg. Let's start with the bias for the glute med and min in the lengthened position. I'm going to have this leg behind the bottom leg. The goal here is to keep the pelvis hiked. So I should feel the oblique on this top side contracting the entire time. So you have to kind of consciously keep that contraction. Hike the pelvis, and then only lower the leg enough to where I can maintain that contraction of the oblique, and then I could lift. So I'm trying to pull this foot almost inward as I lower and then raise. I'm also trying to turn my toes down to bias a bit more internal rotation, since these posterior fibers of the glute med and min are external rotators. Okay, so hike, drop the leg, and up. Hike, drop the leg, and up. So I should almost feel like a little bit of a stretch through internal rotation, through the joint capsule, and then also through this lateral hip here. So it does take a lot more conscious effort. The ankle weight simply does help. We can add some high reps here. And then even for my in-person clients, I tend to use a lot of manual resistance with this as well, where I could push the shoe this way while also directing load downward. So I like to do some high repetitions here, and then a nice hold here at the end. And if we're getting some good range, we can go off the edge of the table here. Again, keeping that oblique tension. If we want to allow the pelvis to drop, we're going to actually get more length through these trunk lateral flexors. And then we're also going to get more length through the TFL because it is a hip flexor. We don't want to be in hip flexion. We actually want to maintain hip extension. We want to maintain a posterior pelvic tilt. So I'm going to pull this bottom knee to chest to keep that posterior pelvic tilt. And then for this one, I definitely want my leg off the edge of the table or the bench here. So I'm going to make sure my foot is in line with my pelvis. Keep that posterior tilt. And then, I could even put a towel roll under the ribs here to keep me side bent toward the table. Now I'm going to let the leg drop, but I'm also going to let the pelvis drop with it. Okay, so I should even be feeling a stretch here through the QLs and the obliques. I can even put my hand overhead. And then as I lift, I want to think about keeping my foot pulled away from the body. So I'm trying to pull farther down, which hikes the bottom side and keeps the pelvis on this side dropped. Again, some manual resistance goes a long way here. And if we're actively pulling away the entire time, we should hardly be able to lift. Okay, if I kept the pelvis hiked like the previous variation, we'll get a little bit more height here. With this variation, we're getting some length into the TFL. We're getting a little bit through the psoas. The frontal plane isn't the primary plane. The psoas gets length through, but it's still slightly being lengthened. And then we're also biasing a lot of short range through the hip abductors, the glute med and min at the top here. But at the bottom, we're getting a nice stretch through the trunk and a strong short range contraction through the hip abductors at the top. Both variations are extremely valuable depending on where you find the majority of your restriction lies. But I will say, if you do struggle with one side of the pelvis hiking compared to the other side, I would give both of these variations a try and do both sides. The way I operate when it comes to postural issues isn't necessarily to be neurotic about one side asymmetries and just focus on one side. I prefer to make sure both sides can shift and move up and down independently so that the brain has an easier time understanding where center is because it knows it can shift and hike and drop on both sides. A lot of postural issues and asymmetries stem from the brain only knowing one direction of movement, so it anticipates that it's going to be moving in that direction, and therefore it keeps you there at a resting state. So give this exercise a try. If you have any questions about the execution, please let me know in the comments. And if you truly felt the difference, please let me know as well. All right, till next time, stay supple.